The Ministry of Health would like you to Halloween safely during COVID-19. Check out our securitometer when planning any Halloween activities this year. Low-risk activities include carving or decorating pumpkins with members of your household, decorating your house, a virtual Halloween costume contest, a Halloween movie night with people you live with, a trick-or-treat hunt. Think of Easter eggs with your household members in and around your home. Medium-risk activities involve one-way trick-or-treating where individually wrapped goodie bags are lined up for families to grab and go, such as the end of a driveway. Wash your hands before preparing goodie bags. A small outdoor costume parade where people are distanced more than 6 feet apart. A costume party held outdoors where masks are used. Costume masks do not count, and people can remain more than 6 feet apart. Visiting pumpkin patches where the use of hand sanitizer, mask wearing, and physical distancing is enforced. Having an outdoor Halloween movie night with local family friends with people spaced at least 6 feet apart. High-risk activities involve traditional trick-or-treating where treats are handed to children who go door to door. Crowded costume parties held indoors, and going to an indoor haunted house, for example, where people may be crowded together and screaming. Once again, the Ministry of Health would like you to Halloween safely this year. This is a message from the government of Bermuda.
Good afternoon, Bermuda, and welcome to the members of the media. Today, I am joined by the Minister of Health, who will be providing an update to the public on the latest from her ministry, including the most recent coronavirus test results. Following that, I will give an update on matters related to tourism, Bermuda Economic Development Corporation, and our recently concluded Tech Week. Minister of Health.
Thank you, Premier. Good afternoon, everyone. From Sunday until Monday, 1,692 test results were received by the Ministry of Health, and 3 were positive for COVID-19. The most recent cases, which are classified as imported, are among visitors who received their positive test results on their day 4 tests. One visitor arrived on the Delta Flight 584 from Atlanta on the 14th of October, and the 2 other visitors arrived on BA's Flight 2233 from London, also on the 14th of October 2020. All cases are asymptomatic. Case isolation and contact tracing has begun. Bermuda now has 188 total confirmed positive cases, and their status is as follows. 5 active cases, who are all under public health monitoring, and none are hospitalized or in critical care. A total of 174 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 56, and the age range of all of our positive cases is from 9 to 101. Overall, 49% of cases are black, 42% are white, and 9% are other or unknown. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all local cases is as follows. 77 are imported, 90 are local transmission with a known contact, 21 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real production number remains below 1. I would like to thank everyone who has come out so far to the Department of Health's Flu Express. The turnout has been tremendous, so much so that we've had to relocate some of the locations to accommodate more people. It is fantastic to see so many people taking charge of their health, and through that, the health of our entire community. The remaining October Flu Express days and locations are as follows. At Pennell's Wharf in St. George's on Wednesday, the 21st of October, between the hours of 10 a.m. and 2 p.m., and at the Clock Tower in Dockyard on Wednesday, the 28th of October, also between the hours of 10 a.m. and 2 p.m. During the month of November, the flu vaccines will be available at the Hamilton Health Center in an outdoor setting using pop-up tents from 2 p.m. until 4 p.m. on Tuesdays, Wednesdays, and Thursdays. Priority persons who should attend the Flu Express are as follows: healthcare workers, caregivers, and essential service workers, persons over the age of 65, any person with chronic medical conditions who are at risk of complications from the flu, such as persons with diabetes, asthmatics, or those with heart disease, as well as children. The flu vaccine is a safe and highly effective method of preventing most cases of flu. Today, as Halloween gets closer, I want to reiterate some of the guidance that I've already provided in terms of how to celebrate safely, which is all based on CDC recommendations. Some low-risk activities which you can do safely this year include carving or decorating pumpkins with members of your household, decorating your house, a virtual Halloween costume contest, a Halloween movie night with people that you live with, and a trick-or-treat hunt with your household members in and around your own home. Meanwhile, moderate risk activities, which you should do only if you can do them safely, are one-way trick-or-treating, where individually wrapped goodie bags are lined up for families to grab and go, such as at the end of the driveway, and also note to make sure that you wash your hands before preparing these goodie bags. A small outdoor costume parade with people who are distanced from each other more than 6 feet apart. A costume party also held outdoors where masks are used, and I don't mean the costume types of masks, and people can remain more than 6 feet apart. Visiting pumpkin patches where the use of hand sanitizers, mask wearing, and physical distancing is enforced, and having an outdoor Halloween movie night with local family friends with people spaced again at least 6 feet apart. And finally, high-risk activities that you should definitely not do this year are as follows: traditional trick-or-treating, where treats are handed to children who go door to door; crowded costume parties held indoors; going to an indoor haunted house where people may be crowded together and shouting or screaming; and any activity congregating densely with people who are not in your own household. And this guidance can be found on our website at coronavirus.gov.bm. We are expecting more visitors to our shores over the next few weeks, so I would like to remind potential travelers about some of the do's and don'ts that they should follow in the period between when travelers are released from quarantine and their day 14 test results. Do not attend events with large groups of people, such as weddings, parties, or family gatherings. Wash your hands regularly. Stay 6 feet away from others. Do not hug or kiss. Keep social bubbles small, if at all. Keep away from crowded places. Stay out of closed spaces with poor ventilation. Exercise outdoors. Choose activities that are outdoors. Wear a mask in all public places, and protect babies, seniors, and persons with chronic conditions by staying outside, wearing a mask, and keeping 6 feet away. I want to end by reminding us all of the 3 C's: closed spaces, and these 3 C's are to be avoided: closed spaces, crowded spaces, and close contact settings. Again, the 3 C's that we should be avoiding are closed spaces, crowded spaces, and close contact settings. In closing, I just want to give a quick shout out to the organizers of this year's Bermuda End to End for rejigging their annual event this year to ensure that it is COVID-19 safe. The event is to be held after a 5-month postponement due to the pandemic, and it will follow all current COVID-19 recommendations, including mask wearing at the water stops, frequent use of hand sanitizer, and physical distancing. Also, participants can start anywhere along the route that is convenient to ensure that there are no large groups of people bunched together along the walk. The event will be used to raise cash for 4 charities: the Bermuda Zoological Society, Vision Bermuda, the Garden Club of Bermuda, and the Family Center. And I urge everyone to come out and join in the fun and help raise much-needed funds for our selected Bermuda charities. Stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you, Premier.
Thank you very much, Minister of Health. As the minister has reported, we have 3 new cases which have been imported. And it is vital that we as a country do not become complacent and continue to be vigilant about maintaining physical distance, wearing our mask, and washing our hands. If you are not feeling well, have fever, or symptoms of the coronavirus, please ensure to take advantage of the free testing that is available to residents and get yourself tested. And you can always contact the coronavirus hotline in case you have questions. The Cabinet Coronavirus Committee met yesterday to discuss matters related to the enforcement of our public health emergency regulations. There is no question that there is pandemic fatigue in Bermuda. Businesses and persons are becoming more relaxed, and some persons are willfully ignoring the public health rules. The government is walking a tightrope between the opening of our tourism economy to keep people working and the reversal of relaxations that have seen us as a community reap the benefits of our collective hard work. It really takes only one person at a crowded space, as the minister said, avoid crowded spaces, or a house party where people are not wearing masks, and as we've seen, it's house parties and small gatherings and not gatherings at licensed establishments in other countries, which are contributing to them going into a second wave and renewed lockdowns, and persons who would not be maintaining their distance at those house parties to set off an outbreak. One person to cause us to go back to hospitalizations of our vulnerable, one person to cause us to move to a place of greater restrictions due to us possibly moving to transmissions in our community. Many of us are aware of the trends and developments around the world, given our access to international media, and Bermudians are well versed about the pandemic developments in our regions and beyond. As a result, we know that many would see some countries in Europe, North America, and other jurisdictions entering into new lockdowns. In the UK, they're called circuit breakers. In place in the Caribbean, lockdown 2.0. And even in New Zealand, who had very good results, are now using a 3-tiered lockdown system. Having come through our own toughest period several months ago, Bermuda is well placed to build on our enviable track record. We do not have widespread community transmission, meaning the only cases that we've had in recent months have been imported, and our diligent contact tracing by the excellent team at the Ministry of Health, combined with persons following health advice, has kept these cases low. These stringent measures we have in place allow us to continue to welcome guests to our shores, and it is important that we take the time to keep the economy open. One thing that I have asked the Ministry of Health, the Minister of Health, and our officials in the Ministry of Health, in addition to ministers who are on the coronavirus committee, specifically dealing with education and transport, looking at what will be the measures that we will take and the rollback provisions of which must be enforced in case there is a new outbreak. And one of the things we don't want to do is to be planning that on the fly, so we are doing and making the preparations just in case that will happen, as I think it is important as we see an increase in cases of all the countries surrounding us, and despite the stringent requirements of which we have, we must make sure that we are diligently planning for any eventualities, and we want to make sure that we can have plans in place that we can activate quickly to minimize any type of disruption that may happen in case there was a new outbreak here in Bermuda. But it's important that we continue to welcome guests to our shores. And not only has airline capacity continued to increase, but we've seen over 350 persons approved to work in Bermuda for a year. Work from Bermuda for a year. That's potentially more than 350 new rents, new residents, and new voices to tell Bermuda's authentic story on their social media or to family and friends alike. And it is key that we know that word-of-mouth recommendations from someone you know are just as effective as well-heeled advertising campaigns. Which brings me to the Reset, Reimagine, and Renew Tourism Summit held last week, and the more than 200 people who attended in person and virtually. Some participants were divided into different venues at Hamilton Princess, with others at Tucker's Point participating via video conferencing. And one of the reasons why it is important that this event was held is we wanted to demonstrate the fact that it is safe to hold in-person conferences in Bermuda. They certainly were not as crowded as they normally were. They did have less persons at the place, less persons at a table, and following all the COVID regulations. But it was critical that we demonstrated that we can hold in-person conferences in Bermuda, and this is something that is one of the first places that we're expecting to recover inside of our tourism market, and it's something that we are actively working towards. As a minister with responsibility for tourism, I must thank officers from the Ministry of National Security, the Ministry of Health, and employees of the Bermuda Tourism Authority who combined to ensure that this event was a safe one. While exceptional advice was shared and global trends discussed, I wish to highlight something that could only happen because of the summit, but was totally unplanned. Many of you would have seen the video that was being shared on Sunday on social media on WhatsApp. A speaker from the Tourism Summit posted a personal video to her social media account. And without payment or prompting, Ms. Evita Robinson posted a video on her Facebook page describing her firsthand experience flying to Bermuda during the pandemic. To date, the video has been viewed more than 25,000 times. Crucially, Ms. Robinson admitted to viewers that prior to flying, the trip and the worry about infection was beginning to induce personal anxiety. However, Ms. Robinson, someone who admitted in the video's travels to wearing a mask, a face shield, and a full-body suit, said Bermuda's protocols were so thorough and convenient that she did not have any anxiety either at the airport or once she was in her hotel room. She gives powerful testament to our coronavirus protocols and the use of proper practice and sound science to reduce the anxiety that the pandemic can cause, but also as an example of how to ensure that we can keep our country safe. Posts like this will continue to help tell the Bermuda story as we look forward to ways to safely welcome more and more tourists to our shores, which is essential to ensure that we can get more and more Bermudians back to work. Earlier today, the Fairmont Southampton staged a job fair for their employees, providing opportunity for local businesses to set up a table and meet Fairmont staff who are looking for work. Some 17 employers, together with a team from the Department of Workforce Development, met with approximately 120 employees. I am grateful to all who participated. It is this type of assistance that is needed during these challenging economic times. The government will continue to provide support to everyone who is looking for a job or who needs help starting their own business. And you will note the press conference yesterday from the Minister of Labor, Minister Jason Hayward, who spoke about the number of plans and activities that the Department of Workforce Development and the Ministry of Labor is engaging in to ensure that persons get back to work. But in addition, our responsibility to displaced workers and to other Bermudians who have made a career in retail and other sectors that support tourism and hospitality, and it is our duty to work to stimulate that economy while also making sure that we stimulate entrepreneurship. Even prior to the pandemic, world economists maintain that small businesses are key to stimulate a country's economy and certainly a country's economic recovery. As a result, we knew that the BEDC would be a valuable resource for small business and entrepreneurs to seek relief and support after the pandemic. Some Bermudians are born entrepreneurs, and some Bermudians leave jobs to strike out on their own, and others return to entrepreneurship because circumstances force them to. Regardless of the path that people take to work for themselves and rely solely on their own efforts, the BEDC is ready to assist and has been supporting small and medium-sized businesses before and throughout the pandemic. With this government support, the BDC has created and/or supported 3 programs that were designed to either provide relief or to help reduce red tape and other obstacles to profitability. First was the Enterprise Bermuda Incubator, launched in 2018. This provided business owners with the skills and discipline to start up their own companies and created 22 new startup businesses. Data from graduates show that 66 new jobs were created, and that is an accomplishment to be proud of. The second scheme was the new Startups Payroll Tax Relief Program, And this is something that makes sure that we eliminated payroll tax and other tax obligations to businesses when they were starting up for their first year. Since being launched in 2018, 49 new businesses have taken advantage of this, and of those 49 new businesses, 81 Bermudians were hired. The final highlight is the COVID-19 Business Aid Loan and Grant Fund. This was launched in April of this year in response to the negative impact the pandemic was likely to have on our economy. So far, 114 businesses have been approved, totaling just under $2.5 million of funding to go towards these businesses. 96% of the funding went to small business owners, and the vast majority, 87% of the successful applicants receiving loan and grant approval. Anyone looking for more information on these programs or how to start your own business is welcome to visit bedc.bm and stop by their offices. It is a key point to note. If you are a business owner who is struggling, resources are there to help and to assist. And I want to make sure to encourage persons to take advantage of that assistance. During the election campaign, I was on the doorstep with some of our candidates, and I encountered business owners who did not know about this assistance that was available. If you are having challenges, especially short-term challenges, please do not hesitate to avail yourselves of the support that is available at the Bermuda Economic Development Corporation, as support is there. I wish to congratulate the newly formed Economic Development Department for hosting its successful virtual conference last week, the Tech Education Summit. The Minister of Education, Diallo Rabane, and I gave remarks, and the keynote message, Inspiring Innovators of the Future, was delivered by venture capitalist Chamath Palihapitiya, who is a well-known venture capitalist from Silicon Valley and who runs the venture capital firm Social Capital. He captured the minds of the attendees with an inspiring vision of harnessing technology to ensure a future that is dynamic and one in which everyone can achieve their dreams. All of the presentations will soon be on the fintech.bm website, and I encourage the tech-savvy and those not so tech-savvy to explore the site and to learn about the various ways that technology can lead to innovative solutions. As Bermuda emerges from the economic impacts of the pandemic, technology will be key to ensure we as a country build an even more powerful economy of the future. Please, I urge you to take advantage of the free training that is available on the website fintech.bm to look at how you can learn more about these exciting industries that are seeing more and more companies licensed in Bermuda every month, creating new jobs here in Bermuda. It is vital and important, and I urge everyone, especially those persons who used to work inside of the banking sectors who may have transferable skills, to take advantage of those courses and to seek out additional assistance from the Department of Workforce Development, as we want to make sure as many persons who have been displaced from one industry can move on to the new industries that we are working on building and creating here in Bermuda. The Cabinet is focused on ensuring that we regularly communicate with residents what work the government is doing surrounding not only the health aspects of the pandemic, but also the economic aspects of the pandemic. Yesterday, as promised, the Minister of Finance and the Minister of Labor gave a press conference to speak about the work of which they are doing to advance the interests of the country. On Thursday, the Minister of National Security was set to give an update around matters around the Ministry of National Security. The Minister of National Security, the Honorable Renee Ming, and the Bermuda Government Weather Service and the EMO are keeping a close eye on Tropical Storm Epsilon, which is still forecast to become a hurricane. This storm is currently classified as a potential threat to Bermuda. The EMO will meet tomorrow afternoon to discuss and put in place any necessary preparations. Minister Ming will hold a press conference tomorrow afternoon to provide an update to the public on the EMO discussions, and her planned press conference on Thursday may be dedicated to pre-hurricane items, but if the track changes, she may give an update on other coronavirus items related to the Ministry of National Security, specifically with focus on enforcement measures, which are being stepped up by her ministry. In closing, this year has proven to be particularly challenging and difficult emotionally for many. High levels of anxiety, together with uncertainty for many about employment, concern about the coronavirus, and the stresses we face during hurricane season can be difficult. If you need help, and if you want to talk with someone, if you need support emotionally, please take advantage of the mental health support line at 543-1111. Once again, that phone number is 543-1111. Emotional support is available, so please do reach out and take advantage of this assistance. You do not have to suffer in silence by yourself. With that, that concludes my remarks, and I'm happy to take questions from members of the media.
Good afternoon, Owen Johnson Barnes with the Royal Gazette. To begin with, over the weekend we had a little bit of a delay in getting COVID responses out. As Bermuda continues to reopen up to visitors and more flights are coming in, do we have enough of a system in place that we can meet that demand?
Absolutely. I'm not sure I'd agree with you insofar as a delay, except for persons receiving results may not have received them in 12 hours, and it may have been up to 48 hours. In fact, under the legislation, we do have a provision that indicates that upon when a person is tested, then they are to receive their results within 48 hours. It just so happens that it has been normally far less than 48 hours. So it wasn't exactly a delay because, as I understand it, all of the test results from the Thursday were completed by the Saturday. So persons did get it within the 48-hour period, which is what our quarantine order actually provides for. Unlike in some places, in some jurisdictions, you may wait 7 to 10 days to get your results. So I think Bermuda's faring pretty good.
Now, while this is probably reiterating things that you've already said today, there has been a growing sentiment online of people asking why they feel the need, why they should wear a mask, given that our only cases are imported and it's a handful of cases. Can you perhaps reiterate why it is important to still wear a mask in these current
Absolutely.
situations?
Any opportunity that I get to reiterate something that's so vitally important that can save lives, I will do so. It has clearly been proven scientifically that you can reduce the transmission and the spread of COVID drastically. I think it's up to 75% is the most recent report that I've read, by wearing a mask. It helps to protect you. It helps to allow or disallow for the spread of the virus through persons that may have it that are asymptomatic, that are speaking to you, sneezing, talking, whatever, recognizing that there are a large portion of persons, the 4 that we just spoke about today, were asymptomatic. So if they were in close contact with individuals and that individual had on a mask, then they are better protected against interacting with somebody that is asymptomatic. So the mask, again, it's very, very scientifically proven that it is a critical feature in combating and mitigating against the transmission of COVID.
Let me just speak to that, Owen, because I mentioned in my remarks too, and the minister is correct, and the minister is very good and diligent in enforcing these rules and working to remind everyone, because pandemic fatigue is real, and we've seen it across the world, and we see the results of pandemic fatigue as well, where persons do not follow these rules, where there were places, unlike Bermuda, who did not have mandatory indoor masking requirements, and see, that now they have to put them in belatedly. It's not something to play with, especially when it comes to our economy. When the minister has stated that, these were persons on their day 4 tests, the fact is that they were not caught on arrival, even though they had a negative pre-test and a negative arrival test, and they are on mobile quarantine, as it likes to be termed, but they should not be engaging freely. But what if they were not? What if we did not have rules where persons who indoors did not have to wear a mask? And if these persons were wearing a mask or not wearing a mask, they could be spreading the virus unknowingly to others. Those persons can then, if they were not wearing a mask when they went somewhere else, could be unknowingly spreading the virus to others. If those persons were wearing a mask, it just cuts down the chains of transmission and the possibility of transmission, and allows us to, if there is an outbreak, to catch people a lot better. I hear the complaints. I know the complaints. Wearing a mask is uncomfortable. People don't like it. But this is a question of, if we get away from the stuff that we know that works, and we see examples around the world of people who just have gone away from stuff that has worked, and we've seen the difficulties of which they've had. We have collectively done so much work, and as painful as it is and annoying as it is, It's necessary. And I just want to give a shout out to the establishments who are doing that work. I mean, every Wednesday when I take my son to football, we stop at Mr. Chicken on the way home. And the lady there will not serve anyone without a mask. And she is adamant on that. And she's like, you're not coming here. It doesn't matter. I don't care. And that's the attitude of which she must have. It is to keep us safe. And so I continue to encourage. I recognize that people online are like, oh, where is this coming from? This doesn't make sense, etc. This is what has kept us safe through these times. And the view that because we have so few cases means that we should stop wearing masks is counterintuitive. The reason why we have so few cases is because we have been wearing masks. And if we don't do that, then we will reverse those trends. And that's why it's critically important that we continue to keep this up. And it's going to be going for a while. We don't like it, but I think it's far better to be uncomfortable wearing a mask than it is to start rolling back relaxations, which are necessary to control the spread of the virus.
While we're talking, Mr. Premier, you mentioned earlier in your remarks that the cabinet were discussing what measures would be put in place if there is another localized outbreak. Can you tell us perhaps when the public might hear more about what these precautions would be and what the triggers would be?
Thank you. That's a great question, and it's certainly something that the Ministry of Health and the officials are certainly discussing. Every 2 weeks, we have something which is called a Scientific Advisory Committee, where myself, the Minister of Health, the CMO, the persons from the hospital, Dr. Weldon as well, we discuss the high-level issues. And one of the things, of course, which we've seen is that we have certainly in October a lot more information than we had on the virus than we had in May when we started rolling back the restrictions, when we created, the 4-tier system on phase 1, phase 2, phase 3, phase 4, and how that works. And so the triggers of which we had put in place at that time were to, what would be the trigger to go back from phase 3, for instance, to phase 2. Now, if we do have a localized outbreak, and we're rolling back to phase 4, rolling back to phase 3. What does that look like? And we've seen from other countries where they've done things such as quick circuit breakers, quick restrictions, mass testing, figuring out how we're going to deploy that. I just wanted to make sure that we were designing that before we may have needed it. So the team that was last week. The team has 2 weeks to go back and chew on that. We're going to be doing certain things around what does that look like in a modified way so that we can go ahead and relay that information so people can understand what may happen and what may come. Because as time goes on, you learn more things. You have more tools in your arsenal, and you have the ability, I think, to be more, I would say, direct versus on a more targeted versus more of a broad aspect and level. Do you wish to add anything to that, Minister?
Only to, if you recall, we've spoken quite a lot about the lead and lag measures, and if you look at our website, we've got the reopening indicators. Likewise, conversely, you can look at that and see if you see like amber or red zones, such as currently the case of mask wearing and physical distancing. Those are going to be factors that will feature into our rollback, so to speak, as the Premier spoke about, but we'll be giving more information to the public in the days to come.
Now, of course, Bermuda is trying to attract visitors to the island. We are trying to reopen our tourism industry as much as we can. But a lot of other countries are going to be doing the exact same thing. More countries are opening up every month as far as competition is concerned. Hawaii, I believe, is opening up on November 1st, for example. I know Bahamas is loosening some of its restrictions on November 1st as well. How is Bermuda going to remain competitive when the competition continues to rank up?
It's difficult, and that's why at the Tourism Summit I spoke about utilizing our competitive advantage at this time. Later this week, on Thursday, I plan on announcing the new chair of the Bermuda Tourism Authority, whose work and efforts will be focused on advancing those matters. I think that in the work with the Tourism Authority, I've been made it very clear that this is a very unique time, and we must take advantage of this unique time, this unique competitive time. But I would say that persons who are looking to travel still want to travel somewhere safe. And the Bahamas did open before, and, they had to roll back. Hawaii may open, and they're using technology that was piloted in Bermuda. With the quarantine bracelets and other types of things. So from that perspective, we are comfortable in being leaders. We know that there's still significant pent-up travel demand in our main markets, such as the East Coast of the United States, and we're going to continue to work to attract that. And as if we can attract higher, I would say, volume of travelers than we did before, then we can be successful. But there's still challenges. There's still challenges with the U.S. CDC rankings and what that is in various state implementations. So there's still work that we have to go through there. We know there was additional information that was sent today as we continue to work through that. There's the challenges with Canada and the fact that they are still not allowing, persons who travel back to have to quarantine for 14 days, which is really putting a dampening effect on that market, which is the opposite when you see with the UK, as I've said, where they're looking at putting on more flights per person. So it's a delicate balancing act. Today in the cabinet, I spoke to Minister Wayne Ferbert, who's dealing a lot with the economic development matters on my behalf, and is going to be working certainly with the Business Development Agency and others to make sure that we ramp up our marketing efforts for the work from Bermuda Residential Certificate. And the Tourism Authority is going to focus more of their energies and efforts on filling seats of persons who are traveling. But it's a changing dynamic as well. So some of the rumors of which we've heard is, hotel properties are going to close. And part of that is because travel patterns have changed. So before, where persons were, making 3 and 4 month out plans and, planning a trip, now we're seeing people with much shorter windows. So it's, 2 weeks to a week and different things like that. So that's the type of thing of which we're now contending with. And so that's what the Tourism Authority is coming to grips with. And that's what the Bermuda Hotel Association is coming to grips with. And our work and energy is making sure that we can just continue to promote the events, continue to ensure that the country is safe, and continue to tell the story. So I think that we'll fare relatively well. Because, and I say this not to be arrogant, I just happen to think that we're doing a far better job collectively as a country than other countries will do. And I think that the Bermudian people recognize how important it is to keep our tourism industry open and will not do silly things of which we've seen in other countries to ruin that.
The other branch, of course, of tourism is the cruise ship side of the industry. Now, I do not know what the current status of it is. I'm hoping perhaps you can update the public as far as what Bermuda is doing to make sure that when cruise ships do return to the island, they return in a safe manner.
I will comment to that. I don't know if the Minister of Health has anything to add because she might have been in her department may have been in discussions, but I think previously we indicated that Bermuda was not going to entertain cruise ships until April 2021, and that was the date in which we had set, regardless of whether or not the U.S. raises their no sail, and that was it. And that was to ensure that we could focus on air visitors and not be rushed on preparations for what the return of cruise passengers may or may not mean. So that means that we have still 5 months of planning. I'm certain that there's been some preliminary steps which have been taken into account between the Ministry of Health, the Ministry of Transport, and certainly in conjunction with tourism. But from that aspect, the view is looking forward to April 2021. And so our focus right now, of course, is making sure that we continue to keep our air corridors open, continue to fill those seats that are coming down, and continue to tell the story that Bermuda is open for business and it is a place that you can come and visit and make sure you feel safe. Anything to add?
No.
Okay.
Final question. And we just had, of course, our elections, and everything went quite well and safely. In 2 weeks, there's another set of elections going on over to our neighbors in the West.
You confused me for a second, Owen. I was like, what elections? What did I miss?
I was wondering how the government was looking at this particular election and how the results might affect its decision-making.
The response of which I give on that is the response of which I give at all points in time. It is never the responsibility of another country to lecture a different country on how their electorate should act or do things. That is for the citizens of the United States, of which my wife is one. That is for the citizens of the United States to cast their ballot for whomever they think will serve their interests best. And the government of Bermuda will continue to maintain its long and fruitful relationship with our major trading partner, the United States. We have an excellent relationship with the United States. I had an excellent relationship with the former U.S. Consul General. I have an excellent relationship with the current U.S. Consul General. The government will continue to engage with the United States representative, and we continue to deepen our relationship in many different ways. So whether it's working on matters of mutual concern, perfect example, you would have seen the Ministry of Legal Affairs, who did excellent work in the recent case with the Mutual Legal Assistance Treaty. I know the Bermuda Police Service took all the credit, but there was significant work from the Attorney General's chambers in working on mutual legal assistance with matters in the United States, whether it's our common work and space and the reopening of the space industry here and the contributions of which that's making and the deepening of that relationship. It will continue. And so whomever is selected as the next president of the United States, whether it is the current president or a new president, we will continue to engage with whomever the United States selects as their person.
Thank you very much.
No problem. All right. And Owen, thank you for coming. We only have one member of the media here, so we will now close out. And I want to just say that certainly it is a time for reflection and a little bit of anxiety. Please, persons, pay attention to the EMO announcements that will come out over the next few days, though it is looking increasingly likely that tropical storm or Hurricane Epsilon will not come dangerously close. We know and understand that storms can always be unpredictable. So it's very important that we pay attention. Of course, everyone, continue to wear your masks. With 3 new cases today that were from visitors that were on day 4, the Ministry of Health is making sure that they're engaging in a process to track down any potential contacts. And I want everyone to be assured that we are continuing to remain on top of this, but you have a part to play, and that is to ensure that you wear your mask and to follow the rules and to maintain your hand hygiene. So with that, I say thank you, Bermuda, and good evening.